I'm ready.
Here is your question. Right, so if you have read and understood, considering it history-taking station, kindly please begin.
Yes. Hello, I'm Dr. Samreen, one of the surgical doctors for you today. May I please confirm your name and age, please?
I'm Linda Roberts and I'm 35 years old.
Nice to meet you, Linda. So can you just tell me what brought you here today?
So doctor, I'm having this tummy ache for one day, and since since last this one day I'm vomiting like so many times. I think 3 times in a row I vomited, and I'm
Okay.
really concerned now, and this tummy ache is just not leaving.
Okay, I'm so sorry to hear that. That must be really difficult for you. So can you just tell me where is can you point to the site of your pain?
It's actually everywhere, but right now it's everywhere, but sometimes it goes to my back also.
Okay. And can you tell me the character of this pain? Is it cramping or stabbing or sharp pain? What kind of pain do you feel?
It's actually cramping.
Cramping. And as you said, it's radiating to the back. Is there anything that increases or decreases this pain?
Actually, I'm because of this severe pain, I cannot tolerate, so I'm taking some painkillers. I'm taking morphine.
All right.
And I've noticed that if I bend forward or if I press on my tummy, then I get a bit of relief. But that's just momentary.
Okay. I'm so sorry to hear that. And can you tell me if the pain has been increasing over has this pain presented suddenly or gradually?
It's gradually. It's there.
Oh,
It's
gradually.
always there.
Okay. And is this pain has any association with fatty meal?
No, doctor, I haven't noticed anything like that.
Okay. Do you experience any heartburn or acidic taste at the back of your mouth?
Uh, Not really.
Okay. And have you been feeling feverish lately?
No, but I feel very weak.
Okay. I'm so sorry to hear that. And just can you tell me if how badly it is affecting your day-to-day life? If you had to score from 1 to 10, and 10 being the worst pain that you could imagine, how much would you rate it?
It's always like it's like a 6, and I've come to you because now it's become like 7, 8. So, I'm taking
Okay, I'm so
medications.
sorry. That must be really difficult. Okay, just very quickly, can you tell me, do you visit your GP for any other medical condition?
Yeah, I have hypertension.
Okay, and for that, you take any medication?
I take amlodipine 5 milligram.
All right. And have you ever had any surgeries before?
Not really.
Okay. And are you allergic to any drug or food?
Not that I know of.
Okay. And has any of your family member has similar kind of
Oh,
problem like
doctor,
this?
I'm
Yes.
diabetic. I'm also diabetic.
Okay. And for that you
And
are
I
taking?
just take oral metformin. I just take oral metformin.
Can you mention the dose and frequency of it?
I think I take 500 milligram. Yes.
Okay.
if I correctly
And
remember.
okay. And any of your family member have similar kind of problems?
My mother is hypertensive and my father is diabetic.
Okay. And can you tell me what do you do for a living? I'm just going to ask you some personal questions.
I'm actually a teacher.
Okay. And who do you live at home with?
My husband and my 2-year-old daughter.
Okay. And do you smoke?
Occasionally.
Okay. And can you mention how many cigarettes per day?
No, not really. Just when we get together,
Okay. And do you
friends.
drink alcohol?
Actually, I do. I'm trying to quit.
Okay.
Yeah.
So how many units per week? Maybe.
Actually, I have a habit of having a pint per day. Yeah.
Okay. Do you take any recreational drugs?
No, doctor.
Okay. So can you tell me what do you think the cause is?
I don't know, doctor, but I have been to the hospital 2 weeks ago with similar pain, and that time they told me that I had some problem with my uh, uh, pancreas, you say? I don't know. And they told me
Okay.
that I had to, stop drinking. I'm trying to quit since then.
Okay. Okay. And so what are you mainly concerned about?
I'm scared. Do I have a cancer or something?
Okay, we
Like,
are going
why
to
isn't the pain going?
it's too early to say if it is cancer or not. We are going to investigate, examine you, and then we'll definitely get the diagnosis. And so what are you expecting us to do for you?
At the moment, of course, give me something so that I get relief from this pain.
Okay.
Okay.
Can you
Definitely
summarize
will.
your history taking now, please?
Yes, this is Mrs. Linda presented with an abdominal pain and which radiates to the back. And she's a diabetic and hypertensive, and the pain usually gets relieved by taking, by leaning forward. And now it's hampering her day-to-day life more. And she's a smoker, occasional smoker, and is alcoholic.
Okay.
So
So
my
what are
main
your provisional and differential diagnosis for her?
So my main diagnosis would be chronic pancreatitis, and
Okay.
but I will also think about pancreatic pseudocyst as well as peptic ulcer disease.
What investigations would you ask for her?
I'll do serum amylase and lipase, then secretin stimulation test, and then CT scan
Yes.
and also serum trypsinogen and MRCP to see if there is any biliary obstruction, and also to see the pancreatic duct. And
What are the
yeah,
treatment alternatives that you can offer to this patient?
at first I'll advise the patient to stop taking alcohol consumption and also stop tobacco smoking. Then I'll try to eliminate. The abdominal pain by escalating the painkillers in stepwise fashion. And if that does not help, then we'll refer her to the pain management specialist. And for intractable pain, then I'll go for the CT guided celiac axis block. And some other nutritional advice will be given to her, like low in fat diet should be low in fat and high in protein and carbohydrate. Then pancreatic enzyme supplements should be given with meal. Then malabsorption, for correcting malabsorption, vitamin A, D, E, K, and vitamin B12 will be given, and also treatment of diabetes as well.
Very good. Okay. Yes. You said you'll manage her addiction. How would you take care of her addiction on your own?
I'll involve some dependency counselor or psychologist.
Very good. Okay. Just this part of that. All right. Good. Thank you.
Thank you, ma'am.
Thank you. Almost you completed your history taking, if I'm not wrong. But was there anything that you left, or if you time would have allowed you, you would have covered?
Yes, I would have asked her about her other systemic conditions, like for the nervous system, like if she has any dizziness or
Yes.
headache, and then also if any joint pain, muscle pain. I would have asked her about her bowel and bladder habits, if
Yes.
they're all right or not, if there is nausea and vomiting, everything.
Any travel abroad history?
Oh, yes.
Yes. Good. Thank you.